Erlanger pediatric nurse Crowe is not only mentally and physically exhausted, but emotionally exhausted. She says the most frustrating part about this surge is the misinformation some patients are getting. As an immunosuppressant nurse with multiple sclerosis, Crowe is risking her life to save others.
If the Lord, takes me because of serving others, then, at least that's what my purpose was.
Working on the pediatric acute care floor at Erlanger, Crowe says she takes care of all her patients as if they were her own kids.
I have an emotional attachment to this. I've watched kids suffer. I've watched kids die, not just COVID, of other things.
As the Delta variant fills hospitals, she says it's not just the children of families getting sick.
That we're seeing families split up, their kids sick and mom's intubated in the ICU or dad's intubated in the ICU, and it's just heartbreaking to see these families going through what they're going through.
Well-being program coordinator at CHI Memorial, Shayla Rose says some healthcare workers not on the front lines aren't as prepared to see this much death.
I think for any of us who have lost a loved one, you realize that it takes time, and it's just hard to do that at the pace that everyone's going at the moment.
But the most frustrating part for Crowe is the misinformation some patients have regarding COVID-19 and vaccines.
Instead of listening to these medical professionals that went to school for years to do this, that's really the most frustrating thing to me.
Crowe says she wouldn't be here if she didn't listen to her doctor's advice, but understands that everyone has a right to their decision.
I think it's your right to choose. I just think we have to understand as Americans that our choices have consequences, and those consequences can be deadly.
Shayla Rose says if you want to give back to healthcare workers, a simple thank you goes a long way.
That Department of Education letter just came out today, so our teams are reviewing those, but I can't comment on that until we investigate further the particular claims of the letter. But we're working hard in the state, as I said before, and we're going to continue to do that every single day.
That same group of parents who make up the focus of that federal investigation feel like they're being forced to choose between their child's education and safety. That's as other students can opt out of mask wearing.
Eric Bettinghoff has one Signal Mountain mom story of a decision that she says has no right answer.
Josh, Latricia, Ottawa High School over here is one of 5 Hamilton County schools right now temporarily switching to remote learning this week. That's something that didn't seem possible under state law at the beginning of this school year. But one group of parents, including that mom we spoke to, doesn't want to wait until COVID numbers get that bad in order to protect their students with increased health risks.
50! Good job!
For Kari Reeves and kids, the school year didn't start out this way.
That's right, first homework and ice cream.
But with COVID cases climbing in schools, it's now a scene reminiscent of last year.
In a perfect world, we'd all be in school learning, but this is not a perfect world. We're in the middle of a worldwide pandemic.
For some families, it's even harder this year, with fewer remote learning options allowed by the state.
It just seems like our only options are to be in school 100%. Or not.
Mother Kari Reeves has extra concerns since her son Davis has Down syndrome and complex medical needs.
Knowing that with his medical issues, if he is to get COVID, he's likely to have complications.
That leaves her stuck in a hard place between keeping her kid safe and getting him the best education possible.
It doesn't feel fair, but that's the situation that we're in.
Tennessee Education Commissioner Penny Schwinn says some families will need to make hard choices.
There might not be a choice where your local school is completely virtual. And as a parent, you have to make the call about whether you want to send your child to an in-person school, which is your local school, or you want to elect for a virtual school.
Kari says her kid's school, Nolan Elementary, has been flexible, allowing her kids to self-quarantine through Labor Day and learn from home. But Kari wants more options and clarity from the state.
It's just tough to be in the position to not feel safe at school and having to make that choice.
Josh, Latricia, we've learned that Kari Reeves is certainly not alone. Coming up at 6, we'll tell you more about that federal lawsuit being filed against Governor Bill Lee that says his mask opt-out policy violates the Americans with Disabilities Act.
This pharmacy in Chattanooga is one of the places in our area that is helping fill the demand for monoclonal antibody treatment, but not everyone qualifies.
Pharmacist Himanshu Patel said Regeneron was authorized by the FDA for emergency use.
So as soon as they're COVID positive, they're eligible to get it. So I would recommend getting it as soon as possible.
But to get it, Patel says you have to be immunocompromised or at risk for serious illness. But some more common conditions also qualify.
About 70% of Americans are eligible if they're overweight or obese, based on their height and weight.
The best method to receive it is through an IV infusion, but places like Medicine Counter Pharmacy offer the next best thing, injections.
We normally use 2 locations around your belly button and then 2 locations in the back of your arm.
Besides pharmacies and hospitals, the city of Dalton just started giving drive-up infusions, with appointments filling up fast. Maeve Ibanez received the treatment and said she felt better almost instantly.
By that evening, my taste had come back, and by the next day, I kind of felt like a different person.
Access Pharmacy in Hickson, one of the first to set up one of these infusion centers, are getting so many calls now. They are setting up more sites for later this week.